Hello, this is Dr. Jazz Ayuri. Everybody knows me as Dr. Jazz. I wanted to talk to you today about breast augmentation with lift. So a lot of patients come to me, and if the nipple is in a good position and there's no loose skin, breast augmentation with an implant is a perfectly appropriate procedure. But I wanted to show you something. Since I have a very nice body, I'm going to use myself as a model. I'm just joking. So I'm going to put the implant here, and I always ask the patient, well, for this breast to look nice, where should the nipple be? And everybody says the nipple should be here, and that is correct. Once you put an implant in, the nipple should be kind of at the highest point of the implant. Now, if somebody has loose skin and the nipple is here, placing an implant is actually going to make the breast look, in a way, weird, because now you have this fullness, and then the skin and the nipple is sliding over the implant. So the correct way to do this is to put the implant in, and then we reposition the nipple, and if we need to, we tighten the skin in the bottom. And there are three types of lift. One that is not commonly used, there's, in my opinion, very little indication for it, is called a Periareola lift. It's really for people who have either large areolas and we need to make them smaller, or they just need maybe a centimeter, half an inch of lift. And so we basically cut around the areola, make it smaller, and then move it up, and the incision will be around the areola. If somebody has more loose skin and the nipple is lower, then we do what's called a vertical or a lollipop lift. And so the incision will be around the areola and all the way in like this, like a lollipop. If the patient still has, the nipple is really low and there's just a huge amount of loose skin, or the nipple could be higher, but there's a lot of loose skin, then obviously we have to do this, do that, and then there's excess skin this way, and we have to make an incision here. Now, sometimes the incision could be less or it could be all the way around. Just depends on how much loose skin they have. Now, I have heard and I've seen some patients who went to another doctor and the doctor said, well, I can do your surgery without a lift. Now, what the doctor does, and I'm going to bring a bigger implant, and I don't know if you can see this. So let me show you. These are the same profile implants. These are all the same profile. So we have low, moderate, and high. And as you can see, this implant has 400 cc and this implant has 500 cc. The implant has to get wider, right? It does get taller, but it has to accommodate the extra volume. So it gets wider. So what this doctor does, or this doctor says you don't need a lift, is they're going to use a very, very large implant. They're going to lower the patient's fold. So if naturally the fold is here, they're going to lower the fold so they can accommodate this implant, right? And now the problem is, yes, the nipple is still at the center of the implant, but the whole breast is now low. So you have a huge breast that's low. And after a while, it's just not very attractive. I have so many patients that come back and we have to redo everything. Now I got to bring the fold up. We got to put a smaller implant, and we have to do a lift. So if you don't have the finances or you don't want any scars, don't do the surgery. I mean, you're going to have more problems with getting a huge implant and a breast that's just too low. So that's, I just want to talk to you about lift and why a lift is needed. Sometimes, again, if a patient is borderline, I just don't know if they need a lift. I always recommend doing the breast augmentation first. We wait at least 3 to 6 months for all the swelling to go away, for the implant and the skin to settle. And then if they need a small amount of lift, we do a lot of lifts under local, and patients can always do that. They have the choice to do it later. So if you have any more questions or you want to schedule a consultation, please contact us or visit our website, www.drjaz.com, drjaz.com. Thank you.